The 5 U.S. states with worst healthcare system. Number 5. Louisiana. Louisiana is plagued by high rates of poverty and chronic illnesses. Over 12% of its population is uninsured, and the state struggles with some of the highest rates of heart disease, diabetes, and obesity in the nation. Maternal health care is especially poor, as Louisiana tops the charts for the highest maternal mortality rate. Number 4. West Virginia. West Virginia faces a perfect storm of healthcare crises. With the highest smoking rate in the U.S., 24% of adults, the state also suffers from one of the worst opioid addiction epidemics, leading to 81 overdose deaths per 100,000 people. Mental health services are lacking, especially in rural areas, where access to care is severely limited. Number 3. Oklahoma. Oklahoma has one of the highest uninsured rates in the country, with 14% of its residents lacking coverage. Chronic conditions like obesity, 39%, and smoking, 20%, contribute to poor health outcomes. With a shortage of healthcare professionals, particularly in rural areas, Oklahomans face long wait times and limited access to care. Number 2. Alabama. Alabama struggles with high rates of diabetes and hypertension. Only 90% of residents are insured, and rural hospital closures have made access to critical care even harder. Mental health services are also lacking, pushing Alabama to the bottom of the rankings for healthcare quality. Before we reveal the state with the worst healthcare, don't forget to like and subscribe. Number 1. Mississippi. Mississippi consistently ranks at the bottom due to highest uninsured rate, 13%, and the worst health outcomes, including the highest infant mortality rate, 8.3 deaths per 1,000 live births. With limited healthcare facilities and a high obesity rate, Mississippi remains the state with the most significant healthcare challenges. Does your state have a good healthcare system? Let me know in the comments.